Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. This is a video intended to talk about journal clubs for psychiatric trainees in Sudan. I know some of the trainees did not get the experience of understanding what does the journal club entails and how to prepare for the process. So this is more of a summary in a simplistic way to explain exactly why do we think about journal club, what is the purpose for a journal club, and what do we do in order to prepare for a good article for discussion in a journal club. First of all, journal club. Why do psychiatrists or doctors think about a journal club? Why do we have to discuss an article in order to criticize it or do a critical appraisal about the whole process? Medicine in general, and even psychiatry, are evolving sciences. What we think about psychiatry nowadays is different from what we thought about it 100 years ago. What we think about psychiatry nowadays is even different from how we used to think about it 30 or 20 years ago. It's an evolving science. A lot of advances happens every day in aspects of psychopathology, in aspects of um, neurobiology, in aspects of psychopharmacology, the way we practice medicine, the guidelines is an evolving science. So that's why, like, in order for us to be familiarized with the process of understanding what is currently going on, and also to differentiate exactly what constitutes a good paper versus exactly what are there is an overemphasized results or there is a biased paper or the methodology does not seem to make sense. To be able to make sense of a paper, that's why like we go and we understand exactly how to do a critical appraisal of scientific literature, and we do it together in a group because we're together at different learning curves. During a journal club, it's a club that constitutes a big group of people or psychiatrists or trainees at different training level. There is the PGY ones, PGY twos. There is the supervisors. There is the senior trainees. There are people who have more experience than others. So, in the discussion, we pass together the science and discuss exactly some of the aspects of psychiatric methodology, or for research methodology, or criticize exactly how the results were discussed, or the process of exactly choosing the sample size, exclusion, inclusion criteria. We learn together how to make sense of the data and how to utilize this data in our patient. And to start with the idea for a journal club, it usually starts against similar to what any scientific process starts with a clinical observation. Usually, what drives the topic for a journal club is basically something that we encounter on a regular basis, a question that arises during our clinical encounter with a patient. We saw something that we did not understand very well. Somebody raised a question during discussion. A good example here: you have a patient who is being treated on second generation antipsychotics, and they have weight gain. And the patient might ask you, is there any way that I can take the medication because they benefit me, yet I don't gain weight? And you go and try to kind of think about it. Is there something in the literature that makes sense that supports such an idea or such options of treatment? And then we move on. Like, this is exactly, you look at the literature, you look at scientific literature, and you try to appraise the literature, try to make sense of exactly the data and whether that makes sense or not in order to realize that this idea in your particular patient. So it starts with a clinical observation, and this is exactly what I'm going to advise all the trainees in the future when they try to consider an article for a journal club, to have the question or the topic being driven from their clinical encounter, either like a clinical management of a patient or a discussion that happens with colleagues. This is exactly how you think about things, and this is exactly how we improve and we move on with medicine. Second, for the purpose of the journal club, we don't look at every single articles or literature. Some literature might be helpful, some literature might not be helpful for the purpose of a journal club. We try to avoid historical overviews because they're not relevant to what we're talking about in the journal club. We tried also to avoid having literature review papers, because this is not what we're trying to discuss. We're trying to discuss a clinical study, right? And even in the clinical study, we try to avoid having meta-analysis. So choose a clinical study for the purpose of discussing and like an article in the journal club. The presentation of the journal club usually happens similar to how we present everything in PowerPoint. It starts with an introduction, and the introduction can include either a case of the relevant case of what you're trying to intend to discuss. And that brings in to tell people exactly why this topic is important and how you thought initially about this topic for the presentation. A good example here, let's say one of the landmark studies in psychiatry are the KD study or the STAR-D study. That studies the efficacy of antidepressant and antipsychotics together in comparison between them. This is a big study, landmark study that all the trainees should be familiarized with. So you ask the question if antipsychotics are similar in efficacy with each other, and then you go in the literature, and then basically, like or a patient asks you, should I consider treatment A versus treatment B? And then you go and read in the literature like to find the study. So a clinical scenario will be appropriate, or basically you tell people why you chose the study. You can start basically by providing the PowerPoint to include aspects of introduction, and that highlights exactly why this topic is important. Then later on, what is this study? What is the purpose of the study? And the aim of the study, what are they trying to answer? What are they trying to achieve? The question of the study. The second, after the introduction, you can go with they go with the methods or the method of the study. And different studies have different designs. There is no perfect design for the study. Every clinical encounter might have what suits them better. And when you discuss the study, you discuss the method, you discuss exactly what people have done, who are the population being studied, inclusion criteria, exclusion criteria, and a discussion about them to see exactly if that makes sense or not. Or basically, even then, this comes later on the critical appraisal of the literature or of the study itself. Have they done this because this is more practical? Have they just done this in order to exclude a particular group of population? What happens when they exclude a particular group of population? Are they going to skew the data or the results in a particular way in order to make a particular point? How does that make the study biased or not? This comes into discussion later on of the study of the method of the study. And this is exactly, it's important for us to understand exactly if this is relevant or not, if this is going to make the study of limitation or not, or if this is more of like a perfect, well-intended study in order to make a point. After we move with the method, we discuss basically the results. That might include aspects of some statistical analysis. I know it might be somewhat challenging for some of us to discuss exactly the statistical methods or the statistical results. But together, and this is exactly what I want to discuss this, you provide this in your PowerPoint presentation, the results, what they have achieved, what they have stated, what they have made, and what they have showed up. And then there is a discussion about the results. This is how these are the aspects of the PowerPoints. Later on, you provide basically the points, like you can put your points of basically whether you agree with the study or not, limitations, points of strength, and then during the process of presenting the journal club, people might get a chance to to discuss, share opinion, raise a question, provide a critical assessment or critical point about whether this makes sense or not. And together, at the end of the day, we come up with some, points that we came up out of the study, whether we agree with it or not. You don't have to choose the most stringent, strong, best designed study in order to present it. You have to present a reasonable paper. At the same time, like you don't have to agree with the paper itself, but it should be a good opportunity for discussion for the trainees, for the supervisor, for the whole group together in order to learn from each other in the journal club. I would suggest for people, especially in the beginning, to choose big landmark studies, STAR-D, KD study, or other relevant study related to what they see on a regular basis. Second, I think once you identify the paper, again, it should be a clinical study, not a review paper, not a meta-analysis, not a historical part. Discuss this paper with your supervisor. And once you agree about the topic, start preparing the presentation in a PowerPoint in the formulation of the reason why you chose to study, an introduction, method, results, and discussion, and then limitations or an opinion about the study. And share the paper of the study with your colleagues at least ahead of time, so it gives people a chance to be able to prepare for the study and read it before they come to the meeting. Usually, such um, journal club or such discussion would last for about an hour, plus or minus, depending on the topic and depending on the extension of the details shared during the meeting. All right, thank you.